Tired of doing everything right for your diabetes, but still battling sugar spikes, low energy, and frustrating symptoms? The missing piece isn't another medication or stricter diet. It's something far more overlooked and far more powerful: minerals. Silent deficiencies in just 3 key minerals can weaken your insulin, wreck your metabolism, and quietly accelerate complications, even when your numbers look normal. In this video, we'll break down the 3 critical minerals every diabetic must know about, how to spot the warning signs of deficiency, and exactly what foods and supplements can help restore balance fast. This isn't just another health tip, it could completely change the way you manage your diabetes. Let's dive in. If you have diabetes and you're feeling constantly tired, cramping up, or struggling with sleep or nerve pain, there's a mineral that could be missing from your body, and it's probably not one your doctor talks about often. It's magnesium. And when it's low, it quietly makes everything harder. Magnesium plays a key role in hundreds of body processes, especially blood sugar control, nerve function, energy production, and muscle health. But if your blood sugar stays high, your kidneys try to flush it out. In doing so, they also remove vital minerals, especially magnesium. That's why people with diabetes are often low in magnesium without even knowing it. And when magnesium is too low, insulin doesn't work properly. This leads to higher blood sugar, which causes even more magnesium to be lost. It's a cycle, and one that can be hard to break. The signs of magnesium deficiency are easy to miss. Muscle cramps, especially in your legs or feet, are a common early sign. That's because magnesium helps muscles relax. Feeling constantly drained even after a full night's sleep is another sign. Magnesium is essential for cell energy. If your magnesium is low, your body struggles to recharge. You might also feel anxious or have trouble sleeping. Magnesium helps calm the nervous system. When it's missing, stress hormones take over. Even nerve issues like tingling, numbness, or burning sensations can worsen due to poor nerve repair and overactive signals. Your heart can also be affected. Magnesium helps regulate heartbeat. Low levels may cause palpitations or irregular rhythms. But it doesn't stop there. Magnesium deficiency impacts your hormones, kidneys, eyes, and more. In men, magnesium supports testosterone levels and sperm health. In women, it keeps menstrual cycles regular and supports fertility. It also helps regulate libido by supporting hormone balance and blood flow. The nervous system struggles without enough magnesium. Pain signals become stronger and healing slows down. Kidneys also take a hit. Magnesium prevents calcium buildup, which means low levels can lead to kidney stones. Vision can be affected too, since magnesium protects blood vessels in the eyes. Without it, oxidative stress rises, a risk factor for diabetic retinopathy. Your cardiovascular system is also vulnerable. Magnesium keeps blood vessels relaxed, helps manage blood pressure, and lowers inflammation. Without it, arteries can stiffen, pressure can spike, and your risk of heart attack or stroke rises. On a cellular level, magnesium is necessary for insulin to work properly. It helps insulin receptors respond so glucose can enter cells. Without it, insulin resistance worsens, even if your insulin levels are normal. Magnesium also helps produce ADP, your body's main energy source. And it helps regulate calcium inside cells. When magnesium is low, calcium builds up, leading to stiffness and inflammation. The best part? You can restore magnesium naturally. Many magnesium-rich foods are easy to add to your diet. Pumpkin seeds are one of the highest sources. Just 1 ounce gives you nearly 40% of your daily needs. Cooked spinach is another great option, with 1 cup offering about 35%. Almonds are also excellent, giving about 25% per ounce. Surprisingly, dark chocolate is a good source too. 1 ounce provides around 24% of your daily magnesium. Avocados are also helpful. One medium avocado provides roughly 15%. These foods don't just raise magnesium levels, they also support blood sugar control, heart health, and overall well-being. If you enjoy cooking, you can build meals around these ingredients. For example, grilled salmon with sesame spinach can deliver over half your daily magnesium while also boosting omega-3s for heart health. Almond-crusted fish with greens is another great way to combine flavor with function. Even a dessert like dark chocolate mousse can help you meet your magnesium needs. If you're not getting enough from food alone, supplements can help, but choose the right form. Magnesium glycinate is one of the most effective and gentle options. It absorbs well and doesn't cause stomach discomfort. Brands like Thorne offer 200 milligrams per capsule, great for muscle, nerve, and sleep support. Doctor's Best High Absorption Magnesium is another reliable choice, also giving 200 milligrams in a highly absorbable form. Stay away from magnesium oxide. It's poorly absorbed and often causes bloating or diarrhea. It's also important to cut out habits and foods that drain magnesium from your body. Processed foods like white bread, pasta, and sugary snacks have little to no magnesium and actually increase how much your body loses. Too much sugar triggers insulin spikes, which cause magnesium to flush out through the urine. Caffeine from sodas or energy drinks blocks magnesium absorption. Alcohol is another major problem. It depletes magnesium stores and interferes with how your body uses the mineral. Even taking too much calcium, especially from supplements, can compete with magnesium in the digestive system and worsen a deficiency. So, if you're feeling unusually tired, dealing with cramps, nerve pain, sleep issues, or unstable blood sugar, don't ignore the signs. Low magnesium might be the missing piece. By focusing on the right foods, removing things that deplete magnesium, and using a high-quality supplement if needed, you can support your energy, blood sugar balance, and overall health. And the results? You'll likely feel stronger, clearer, and more in control, all by fixing one quiet but powerful deficiency. Number 2, zinc. If you're living with diabetes and constantly dealing with sugar cravings, slow healing, or low energy, one nutrient might be quietly making everything worse: zinc. It's one of the most underrated minerals, yet it plays a vital role in blood sugar control, immune support, and overall health. Most people don't realize how quickly zinc gets depleted in diabetes. High blood sugar leads to frequent urination, and with it, key nutrients like zinc are flushed out. Chronic inflammation, common in diabetics, also uses up zinc as the body repairs cell damage. Some medications, such as ACE inhibitors and diuretics, can further reduce zinc levels. Zinc deficiency is often missed because the symptoms build slowly. One clear sign is slow wound healing. Zinc supports tissue repair and cell growth, so if cuts take too long to heal, low zinc may be the reason. Getting sick often is another red flag. Zinc is essential for immune defense. Struggling with sugar cravings? Zinc plays a role in appetite regulation and insulin function. When levels are low, cravings can spike. Skin problems like dryness, acne, or rashes may also appear, as zinc supports collagen production and skin repair. Other subtle signs include reduced taste or smell, white nail spots, or thinning hair. Zinc also supports reproductive health. In men, it's needed for testosterone and healthy sperm. Low levels reduce sperm count and quality. In women, zinc helps balance hormones and support ovulation. Low zinc may disrupt cycles and reduce fertility. Libido may drop in both sexes, as zinc helps maintain sexual energy and hormone levels. Zinc is crucial for nerve health, too. It helps repair nerve tissue and reduce inflammation. If you have diabetic neuropathy, tingling, burning, or numbness, zinc deficiency can make symptoms worse. It also supports kidney health by controlling inflammation. Without it, kidney disease risk increases. Vision can suffer as well. Zinc protects the retina and reduces oxidative stress, helping prevent or slow diabetic eye issues like retinopathy. Zinc also helps the heart by lowering inflammation, supporting artery flexibility, and balancing cholesterol. A deficiency increases the risk of high blood pressure, heart disease, and stroke. At the cellular level, zinc is key for insulin to work properly. It helps insulin bind to cells and move glucose out of your blood. When zinc is low, insulin function weakens, making blood sugar harder to control. Your pancreas also relies on zinc to store and release insulin, so deficiency slows this process too. Zinc also protects your cells as a powerful antioxidant, reducing inflammation and oxidative stress, major contributors to diabetes complications. Without enough zinc, the body becomes more vulnerable to damage, aging, and poor healing. The good news is it's easy to boost zinc through food. Oysters are the best source. Just 3 medium oysters provide more than double your daily needs. Beef liver is another excellent option, with 100 grams offering about 80% of your requirement. If you're plant-based, pumpkin seeds are a great option. 1 ounce provides around 50% of your daily needs. Grass-fed beef offers about 40% per 100 gram serving, and chickpeas give around 25% per cooked cup. These are simple, nutritious ways to add zinc to your meals. Even gourmet meals can help. Oyster sashimi with ponzu sauce provides over 200% of daily zinc needs. French beef tartare with a quail egg gives about 90%. Grilled lamb chops with a pumpkin seed crust deliver around 80%, along with other nutrients that support insulin and hormone balance. If food isn't enough, high-quality supplements can help. Zinc picolinate and zinc bisglycinate are among the best absorbed. Thorne's zinc picolinate provides 30 milligrams per capsule, while Now Foods offers a glycinate version at the same dose. Both are gentle and effective. Most adults with diabetes benefit from 15 to 30 milligrams of zinc per day. However, it's important to balance long-term supplementation with copper, since excess zinc can interfere with copper absorption. Just as important as getting enough zinc is avoiding things that reduce it. High-sugar diets increase zinc loss through urination. Whole grains and legumes contain phytates, which can block zinc absorption, though soaking or sprouting them helps. Too much calcium from dairy or supplements can also interfere with zinc uptake. Alcohol is another big problem. It depletes zinc and raises inflammation, making blood sugar control more difficult. Junk food only adds to the issue, offering no zinc and worsening inflammation. Zinc may not be as popular as other nutrients, but for people with diabetes, it's essential. Without it, insulin function weakens, blood sugar control slips, and complications can develop faster. By increasing your zinc intake through food or supplements, you can improve insulin sensitivity, support nerve and kidney health, boost your immune system, and even help with fertility and hormonal balance. It's a small nutrient with a big impact, especially if you're trying to take better control of your diabetes. Number 3. Chromium. It isn't talked about much, but if you have diabetes, it's one of the most important minerals for your health. When blood sugar runs high, your body flushes out excess glucose through urine, and chromium goes with it. Over time, this quiet loss can make blood sugar harder to control. Like magnesium, chromium isn't stored in large amounts, so you need to replenish it daily through food or supplements. It plays a key role in helping insulin move sugar from your bloodstream into your cells. Without it, insulin simply can't do its job effectively, and blood sugar levels rise. Unfortunately, many things speed up chromium loss: stress, processed foods, high-carb meals, and frequent urination. Since the symptoms of low chromium look a lot like common diabetes issues, most people never realize they're deficient. If your blood sugar feels harder to manage even though your routine hasn't changed, low chromium could be to blame. It also helps regulate appetite and cravings, so when levels drop, you may feel hungrier or crave sugar more often. Tiredness, brain fog, or even anxiety can also be signs, as chromium supports energy production and brain function. In more advanced cases, you might feel tingling or burning in your hands and feet. Low chromium can stress the nervous system and worsen neuropathy in people with diabetes. It also impacts reproductive health. In men, it may lower testosterone and sperm quality. In women, it can disrupt hormones and make cycles irregular. Low chromium can reduce sex drive, slow circulation, and raise the risk of nerve damage. It also weakens your kidney's defenses against oxidative stress, speeding up diabetic kidney complications. Eyes can suffer too. Low chromium is linked to worsening diabetic retinopathy. Your heart isn't immune either. Chromium helps balance cholesterol and support healthy fat metabolism. When you don't get enough, LDL, bad cholesterol, rises, arteries stiffen, and the risk of heart disease increases. At the cellular level, chromium boosts insulin's power. It's part of the glucose tolerance factor, which helps insulin move sugar into your cells. When chromium is low, insulin becomes less effective, leading to higher blood sugar and more strain on your pancreas. Over time, this can lead to greater insulin resistance. Chromium also helps your body break down carbs and fats. Without it, you may feel sluggish, gain weight more easily, and struggle to use glucose efficiently. Now for the good news. It's easy to increase chromium through food. Broccoli is one of the best sources. Just half a cup gives you about 50% of your daily needs. Grape juice provides around 40% per cup, though it should be consumed in moderation due to sugar. Brazil nuts are another great source. Just one nut provides around 30%. Lean beef gives about 25% in a 3-ounce serving, and eggs offer 10 to 15% each. These are easy, everyday foods that support healthy chromium levels. If you enjoy gourmet meals, there are creative ways to add chromium to your plate. A Wagyu steak with sautéed broccoli and Brazil nut pesto can deliver more than 75% of your daily chromium needs. A Mediterranean lamb chop with rosemary grape reduction and asparagus gives around 60%. A French duck pâté with poached eggs and roasted mushrooms can supply close to 50%, along with extra support for blood sugar control. If food alone isn't enough, high-quality supplements are a good backup. Chromium picolinate and chromium polynicotinate are the best absorbed forms. A trusted option is Now Foods Chromium picolinate, which delivers 200 micrograms per capsule, ideal for daily use. Thorne Research offers a 500 microgram version for those with greater needs or confirmed deficiencies. Most people with diabetes benefit from 200 to 500 micrograms per day, depending on their individual situation. Always monitor your blood sugar response and consult your healthcare provider before adding new supplements. It's just as important to avoid things that deplete chromium. Refined sugar and processed carbs are top offenders. They raise insulin demand and drain chromium quickly. Too much calcium from dairy or supplements can block absorption, and alcohol further speeds up chromium loss while worsening inflammation. Highly processed foods like white bread, sugary snacks, and soft drinks not only lack chromium, but also contribute to insulin resistance. The more you eat them, the harder it is for your body to hold onto this crucial mineral. Chromium may not be a household name, but for people managing diabetes, it's essential. It helps control blood sugar, improves insulin sensitivity, protects nerves and kidneys, and supports hormone balance and metabolism. If you're dealing with constant cravings, stubborn blood sugar, or low energy, chromium could be the missing link. By boosting your levels naturally or with supplements, you give your body the support it needs to fight back against diabetes and feel more in control. If you found this video helpful, hit that like button, share it with someone who needs to hear this, and don't forget to subscribe for more life-changing health tips. Turn on the bell so you never miss an update on how to take control of your diabetes naturally. Drop a comment below. Which mineral are you focusing on more these days? Magnesium, zinc, or chromium? Thanks for watching and take care of your health, one small change at a time.